Hey Weingarten, all you M critters. Graham Inglesby from Denver here. And I gotta ask, does size really matter? We're all taught that with our sickest of patients, one of the first things to get is two large bore peripheral IVs. But what does that really mean in terms of resuscitation? Poisson taught us that the rate of flow of fluid through a tube is dependent upon radius and length, noting that radius is raised to the fourth power. How does this apply to taking care of patients? A standard 16 gauge IV can infuse at about 220 cc's per minute. One size up to an 18 gauge and your rate drops to about 110 cc's a minute, and a 20 gauge is only going to deliver 60 cc's a minute. Or, for every single increase in peripheral IV size, your rate doubles. What about central lines? They dribble in at only about 30 cc's a minute, so your patient's going to be waiting until next shift to actually get resuscitated. So, bigger is better, but it's not everything. Don't forget about the motion in the ocean. Get all buff caps out of the way, consider a pressure bag, or an infuser, or just give a good squeeze if you've got to resuscitate your patient.
My name is Dr. Jessie Lohman. I'm a PGY2 at LIJ. Today I'm going to talk to you about bringing resuscitation outside the emergency department, something our wilderness medicine colleagues have known about for a while now, and that's redosing extra doses of epi from an EpiPen. We all remember the movie My Girl, where Macaulay Culkin died of anaphylaxis after a misencounter with a hive of bees. Now, this death could have been avoided had he had an EpiPen, but we all know one dose of epi doesn't always do the trick. What if you're far from home?
Getting the extra epi is easy. After you've injected the first dose, remove the wrapper from the pen. You're then going to score the pen using a camping knife. Crack the pen open. Remove the syringe from the inside of the pen.
Remove the safety from the needle. Pull some air back into the syringe, and there you have it. You have 3 extra doses of epi ready to go. The auto stop on the syringe will give 0.3 milligrams each dose.
This patient needs a transvenous pacer. Sounds like a job for Bat Doc. First, gather your supplies, including the Bat Pacer. Set rate to 30 beats greater than the intrinsic rate, output to max, and sensitivity to asynchronous mode. After donning a sterile bat suit and placing a 6 French introducer sheath, take your pacer wire and check the bubble. Next, preload your sterile wire sleeve. Feed your wire in 20 centimeters to ensure the balloon tip clears the sheath, then inflate the balloon and lock. Have an assistant help plug the bat pacer in, proximal wire to positive, distal wire to negative. Slowly advance the wire while watching the monitor until a rhythm captures. Bingo! Patient resuscitated. Finally, deflate the balloon, place and lock the sterile sleeve, secure the wire, then adjust pacer settings as needed. I'm Bat Doc.